webinar with the APP3 Biosafety and Biosecurity Action Package. I'd like to welcome you on behalf of the Task Force on Advocacy and Communication, and to remind everyone that the meeting today is being recorded. It will be available solely at this point to the action package to share through its usual channels with the stakeholders of the Biosafety and Biosecurity Working Group. If you have any concerns, please register them in the chat. This is an interactive session, which means that you have the ability to share interventions either through the chat function or at points when we have in the agenda, when we are open to discussion and questions, to use the raise hand function, which you'll find in the bar at the bottom of the screen, or indicate in the chat if you would like to make an intervention by voice. We do ask that when you are not presenting, speaking, or moderating, that you please turn off your microphone out of courtesy to others. And at this point, I would like to thank you all for your time and to turn this over to Dr. Hanan Idris of the Action Package Coordination Task Force.
Good morning, good afternoon, and good evening, everyone. My name is Hanan Idris, and I'm representing the Kingdom of Saudi Arabia and the Task Force on Action Package Coordination, along with our co-leads from the United States of America, as well as the Kingdom of the Netherlands. Today, we are hosting the GHSA Global Lessons Observed webinar series, specifically hosted by the Biosafety Biosecurity APP3 Action Package. And today's session is going to be on closing the gaps in health security, strengthening biosafety and biosecurity capabilities globally. The GHSA Lessons Observed webinar is a series that's being launched as a result of recommendations from the GHSA community. And the webinar series is an opportunity to bring together different action packages and collective wisdom to address common challenges in global health security and public health challenges. And it's an opportunity for us to also develop partnerships as well. I'd like to thank the GHSA Chair, Italy, for their strong support throughout the planning process for this series that started earlier this year. And that being said, I would like to welcome the 2022 GHSA Chair, represented by Dr. Sandro Bonfigli from the Ministry of Health in Italy, to share opening remarks. Dr. Bonfigli.
Thank you very much. My role here is really easy. First of all, to thank all the people that contributed to this webinar, both the task forces, the Action Package Coordination Task Force and the Advocacy and Communication, and especially the Action Package itself that is giving this webinar today, and to say to thank all the participants for being here, and to say how much this series of webinar is a bit of a showcase of the advantages and the role of GHSA, and how it is useful to increase the collaboration between the action packages and to divulge to all us members, and also beyond the member of GHSA itself, the activities and all the good activities that are done. Say that, I don't want to steal you any more time for this really interesting webinar, and I thank you all, and I give back the floor to Dr. Idris.
Thank you, Dr. Bonfigli. I'd like to welcome everyone again, and without further ado, I'd like to pass over the mic to my colleague, Gabby Essex from the Action Package. Thank you, Gabby.
Thank you so much, and hello, everybody. My name is Gabby Essex, and I'm a part of the Biosafety and Biosecurity Action Package, or APP3, and I will be serving as today's MC. And just as a quick reminder to everyone on meeting and logistics, this meeting is being recorded, and we will make it available following the meeting. Please keep your microphones on mute, and if you wish to speak during the participatory parts of the meeting, then you can just use the raise your hand button, and please utilize the chat for any discussion or any questions you have that we can attend to during the Q&A session. Next slide. So today APP3 is excited for presentations from the co-chairs and also from some APP3 members. So after today's logistics and overview, we will have presentations on just a quick overview of the action package. Then we'll have a presentation on how we're progressing towards GHSA goals, specifically around biosafety and biosecurity. We'll hear from some members and how they are working to address filling those gaps with biosafety and biosecurity capacities, specifically around some of the trainings that they've been providing. And then we'll wrap up with a quick talk on the future of biosafety and biosecurity, and then we'll have closing remarks. Next slide. And we will now shift into the first part of our agenda, preventing the next catastrophe, filling known gaps in biosafety and biosecurity through APP3. We will hear from APP3 co-chair, Dr. Issa Makumi, as he provides an overview of the history of the Biosafety and Biosecurity Action Package and how we are currently trying to drive action forward on biosafety and biosecurity. We will then hear from a member from the GHSA Accountability and Results Task Force, and he will be presenting, giving a presentation on highlighting how we're tracking progress to improve capacities and provide an update on the progress of the 2024 target. With that, I would like to introduce Dr. Issa Makumi. Dr. Makumi is the Deputy Director of the Ugandan National Institute of Public Health and the director of the Public Health Emergency Operations Center. He's been working in the health sector in various positions as a physician and a public health officer for over 35 years at the district and national level. Dr. Makumi has overseen detection of and response to over 30 outbreaks in Uganda since 2010 and has emerged as a leading subject matter expert on the global stage, having participated in GHSA and JEE assessments. And he's currently the GHSA co-chair with Africa CDC. So I would like to now pass it over to Dr. Kumbi to give the presentation.
Thank you very much, Gabby. As you have said, I'm going to give an overview of the Biosafety Action Package 3. Next slide, please. Next slide, please. I just want to say a few things about who we are in AP3 and what are our inspirations. And before I do that, I just want to recap or to refresh your memories that biosafety practices aim to protect people and the surrounding community environment from accidents associated with exposure to unintentional or release of dangerous pathogens, while biosecurity practice aim to prevent unauthorized access to or loss, theft or deliberate release and the misuse of hazardous biological agents which can harm the environment and the people associated with research-related information. National governments and institutional oversight to help ensure that the dialogue on appropriate biosecurity and biosafety is taking place continuously, because science is also developing all the time, and it develops with some risks which we need to manage actively. Biosecurity and biosafety practices help nations to counter both natural, man-made biological threats while fostering safe scientific progress and achievement. Next slide, please. Next slide. Thank you very much. Action package, who are we? We are a collection of experts and leaders with cumulative membership of both countries and international organizations that seek to advance global security and safety capacity and auspice of global health security agenda in support of various international instruments and conventions and agreements, including international health regulations, biological weapon conventions, United Nations Security Council resolution, 1540, so that we want to make sure that this most of the countries, all the countries are compliant of this international commitment and agreement and convention. What drives us is to really to work in collaboration with with technical experts across the spectrum of security to enable the progress towards the target of global security 2024. You remember that we have the project of global security will end in 2024, and the target is we seek to advance about 100 countries to have at least demonstrated capacity in 5 of the technical areas, that is level 4. And we want to make sure that biosecurity and biosafety are part of those achievements by 2024. Next slide, please. How are we enabling our progress? We promote global compliance with biosecurity and biosafety targets by spreading key messages in all opportunities or relevant fora, increasing membership. And I will be asking you, those who are not members, to join us. AP3, making tools available for member states seeking to make progress in the area of biosafety and biosecurity, tackling progress towards global achievement of biosecurity and biosafety targets, using both information to identify priorities for further capacity building where it's necessary. Liaising with partner countries and pairing committed countries, looking forward to support with the countries seeking direct resources towards effective capacity building in the area of biosafety and biosecurity. As you know very well, members, most of the countries are not doing very well in the scorecard in the technical area of JEE tool, that is Joint External Evaluation Tool. The scores are not yet good. We really need to improve on the scores in most of the countries, especially the low and middle income countries. Next slide, please. So how are we doing this? We have developed a plan to guide us and how we can do this of biosecurity and biosafety. And we have 3 strategic objectives. One is to improve action package efficiency and functioning. And here I want to specifically, one of the key objectives or strategic objectives is to expand the action package network. We are only about 22 countries and a number of international organizations, but this is not enough. Biosecurity, biosafety is a public good. So there is nobody who should really opt out. So we need more members. We want to expand the network from 22 countries to more than 50 or 60 countries. So this is one of our strategic objectives and one of the key strategic activities. Our second strategic objective is to emphasize the importance of biosecurity and biosafety to external audiences, those who really are not part of this domain. We want to coordinate all the action package activities, identify financial and technical resources and tools which will enable people to move forward and really develop a robust biosafety and biosecurity space. The third strategic objective is to facilitate capacity and capability improvement and research. There are many things actually unknown. We need to get this new knowledge so that we can improve, conduct training, capacity building, and create conducive legislative environment so that we can implement the activities to make sure that we achieve the targets of biosecurity and biosafety in this space of global security agenda. Next slide, please. Next slide, please. Thank you. So this is an appeal, is that those who have not joined us, as I've told you, please join us because we are a world community. You know now, this is a global village now, so we need to work together. So what threatens you threatens me. If I fail, that means also you fail. If we work together, we can go further, we can synergize each other, we can cross-fertilize each other so that we have a robust biosecurity and biosafety in our environment. Join us, and when you join us, you allow members to do more together than one, and you would use your expertise and solution to really upscale the biosecurity and biosafety space in the global space. We have a proverb which maybe I want to teach you. He said, "Kamu kamu gwe muganda," which means one by one makes a bundle, and a bundle is stronger than one. And that's why I'm appealing to you to come and join us so that we are stronger, and then we can put a dent on some of these issues of biosafety, biosecurity, which is a global public good. Maybe I'll end with this quotation that we learned how specific actions have encouraged biosafety and biosecurity in other countries. Consequently, we become aware of our own gaps and guided towards improving the urgency needed. So AP3 is a community for sharing, learning, awakening, supporting each other so that we, at the end, all of us benefit from biosecurity and biosafety in the global health security space. So members, this was really an overview on what we are, what drives us, and what we are appealing to you to join us. Thank you very much. I submit, Chair.
Thank you so much, Dr. Makumbi, for that overview of the action package and the actions we're taking to drive action forward on biosafety and biosecurity. Now we will turn to our next presenter, who will be discussing on how that action is being measured. Dr. Richard Garfield is the acting team lead for the Global Health Security Team in the Division of Global Health Protections at the Center for Global Health at the US CDC, and he is a professor emeritus at Columbia University in New York. With that, I'd like to turn it over to Dr. Garfield.
Hi, everyone. I'm going to summarize where we are at in our progress in this action package area. Next slide, please. Next. To reiterate what Dr. Makumbi said, our goal with 100 countries is to complete the evaluation of health security, which we have already surpassed 100 countries. It's now 116. That countries undergo planning and resource mobilization, which in some level or in some way, most countries have done. And the key here for measurement is to strengthen capacity and demonstrate improvements in at least 5 technical areas to reach a level of 4 or 5 in 100 countries. So that's not only biosafety and security, but in any of the 19 areas of the JEE to reach a level of 4 or 5 in 5 areas out of 19 in 100 countries. That is our overarching global goal. Next slide, please. Here's where we are so far. For 100 countries, and of course there are now more than 100 countries who have engaged, but we're doing with the first 100. 56 countries have met at least 5 of the areas to reach a 4 or a 5. 20 are close to reaching 4 or 5, and the rest are not yet close. So we'll be discussing both those who are close and those who are not so close to meeting those targets, particularly in the area of biosafety and security. Next. Here are overall those countries that are close to the target. These slides will be available to you so you can see the countries and the areas where they are close. That is to say that they have achieved a level of 3 and they are on their way, having more than achieved the minimum for a level of 3 and are approaching a level of 4. And then on the right on the slide, you can see the technical areas that are specified on the left of the slide. Next. On progress toward the target for biosafety and security. Now, from now on, we're just talking about this one. It's actually 84 countries have a score of 4 or 5 on biosafety and security. Many of those countries had a score level high like that. Those are essentially the the OECD countries and some of the other middle or upper income countries started or reached that level. Before we were talking about a total of 100 countries as the goal, but here we are looking at all the countries that are responding to the SPAR, which in the process of the JE has increased, virtually all countries, and we're now at, I think, not 186 last year who reported on the SPAR. So these numbers cannot be compared directly to the earlier circle that I showed you of 100. But we have 36 countries that are at a level 3 on biosafety and security, and 76 that are below a level of 3 that have a considerable way to go. On the right, you see countries that are close to the target in the area of biosafety and security for the potential interest you may have or involvement in some of those countries. Next. My last 2 slides summarize benchmarks that have been developed in order to focus countries on their actions. If you are at a level of 2 and you want to reach a level of 3, these bullet points are probably the activities that you should be engaging in your country or in assisting another country in order to achieve the level of 4 in the first of the 2 indicators that are used for biosafety and security. So for the whole of government biosafety and security system to be in place for human, animal, and agricultural facilities, for example, a country would need to develop a biosafety and biosecurity national framework, maintain inventories for dangerous pathogens, and secure the dangerous pathogens and toxins at a minimum number of national level laboratories. If you are seeking to reach a level of 4, having already reached a level of 3, you will in addition develop site-specific biosafety and supportive documents to include incident response and emergency plans should there be an incident, and develop documents for dual-use research and responsible code of conduct information for scientists and staff. Those are examples. I'm not going to read them all, but you can see our point in developing the benchmarks was to facilitate countries to identify the kinds of activities that are going to be most useful to them to then be able to say they have reached that level. These are not proscriptive. These are suggestions of activities, and there may well be other activities that a country may want to engage in as well. So that was the first of the 2 indicators. Next slide for the second indicator. Biosafety and security training and practices in all relevant sectors. Some of the benchmark activities would be to adopt in-service and continuing education training curricula. Train and oversight facilities are formed that are housed or working with dangerous pathogens and comply with the regulations. And then for a level 4, to implement training programs and oversight and assess that they comply with the biosafety and security rules, and implementing sustainable training programs. So the first indicator focused on the functional activities that are required for biosafety and security. And the second indicator has to do with the training to achieve the skill and knowledge levels in countries. And I've summarized here some of the benchmarks that can be used to assist countries. You could look at our current status as a glass half full or half empty, because many countries have achieved or had already achieved good levels of 4 or 5 out of a scale of 5. But most of those countries that had not achieved those levels have still not achieved them and are working on the path toward achieving them. So there's the world that had good levels. There are some countries that have achieved improving levels, and there's much improvement still to do for other countries to reach those levels. That's where we're at. And that concludes my comments here. Thank you for your attention.
Thank you so much, Dr. Cartfield, for that presentation and for updating us on where we are at with biosafety and biosecurity, hitting those targets and identifying those benchmarks. And I would like to think of it as a glass half full as well. And as we transition into, excuse me, our panel, you'll hear from some of our members who are really, from some of our members who are working to improve those capacities as well. So I will pass the floor over to Peter, who is one of our APP3 co-chairs, to moderate our panel of APP3 members.
Thank you so much, Gabby. Can you hear me clearly?
We can hear you, Peter.
Okay, great. So I'm very excited to be hosting you all, and we will dive right in. We are going to have 3 wonderful presentations from our members in this session. And to kick it off, we are going to have we're going to have Ms. Gail Trotman, and she's an environmental toxicologist attached to the BOS Santos Public Health Laboratory. Gail, I'm sorry if I butchered that one, and that is in Barbados. She joined the ranks of the lab in 1994 and has been involved in laboratory safety since 1997. Currently, she holds the post of Senior Lab Technologist with responsibility for environmental laboratories and risk management. Ms. Trotman has been the national biosafety focal point for Barbados since 2016.
Yeah,
That is
Peter.
my network breaking up.
Can we please pause for just a minute? Sorry, Peter, our apologies, but there's a great deal of interference and it's very difficult to hear. Can we please ask everyone to mute themselves if you're not speaking? And I will be policing that. Thank you, Peter. Our apologies. Please go ahead.
And then
I want to first rule out that I'm not the source of the noise. Can you hear clearly?
yeah, Peter, I can take over with the introductions if you're having some background noise issues. Okay, I can do it, Peter, no problem. Thank you. So he was introducing Miss Gail Trotman, and then I will start introducing Sam Dietrich, our second presenter. So Miss Dietrich has over 15 years of domestic and international experience in global health security, and she is she's leading American companies global health security program, directing and managing a multifaceted series of projects on global health security with emphasis on biosafety and biosecurity. And she's the current chair for the Global Health Security Agenda Consortium. And then I'll introduce our last speaker, Ms. Jennifer Lastly. She is the Senior Program Manager for the PVS Pathway and WHO/IHR in the capacity building department at the World Organization for Animal Health, or WOA. So for this panel, each of our presenters will do a short presentation, then we'll open it up into a Q&A session. So please feel free to drop your questions into the chat box, and we will answer them following the presentation. So I will now like to turn it over to Ms. Trotman.
Good morning, everyone. Can y'all hear me clearly?
Yes.
Okay. Good morning again. So I am from Barbados, and Barbados is a small, very small country, approximately 166 square miles with a population of about 300,000 souls. We are in the Caribbean, for those who don't know, and fairly friendly. We have been in the from when I came into the field of biosafety, we have been trying our best to see how we can, improve the way how we do things in our labs on the island. Next slide. So in 2017, and then again in 2022, currently this year, we conducted a survey to see how many labs there were on the island. And in the first survey, it was quite surprising that we had so many laboratories that were involved in so many different aspects of lab operations. These were things that we didn't know, even though the country is very small. They were private labs, they were public labs, as you can see. And what was most startling was the number of teaching and research laboratories that were on the island. So having used that information, we formed what we will call an informal network. Next slide. Next slide, please. Yes. So as I said, our network is basically, we operate basically on two levels for our laboratory safety network. So we have a formal network, which is a cooperative agreement between the CDC as well as through CARICOM via the Caribbean Public Health Agency. And we also have an informal network on the islands among all the laboratories, the public laboratories, the private labs, the teaching institutions, and we also include our professional bodies. Yes, using that way, we were able then to be able to assess where all the labs were at the level, what level of biosafety they were practicing in their institutions. And we also were able to use that information to look and see what their training needs were. Next slide. So having done that exercise and been able to establish what training was required, then we were able to carry out a series of training sessions over a number of years. Some of the accomplishments that we had were that we were able to engage the professional bodies, and this picture shows actually one of the sessions that we had that included persons from laboratories. We also had pharmacists, we had nurses, we had different people who were in different disciplines in healthcare, and they were able to come and listen on that particular day. We were looking at a culture of safety, and then we also had risk assessments done as well. Next slide. We were also able at the laboratory level to cover some training in use of respirators and fit testing and looking at the selection and proper use of PPE and waste disposal and decontamination, because we thought that those are things that are required by all the labs, and those were the priorities. So we had 2 rounds of training over the number of years. One was in 2018, and then we had another one in 2019. And those were the things that we did. And it was, for us, I thought it was quite fitting, especially because we had the training in the use of respirators, because as we all know, we just went through we are still on the tail end of a pandemic. And because of that, it made it so easy for us when the need arose that persons then they were required to use respirators, that it wasn't foreign to them. And we also had persons who were trained to do the fit testing. So then we were able to assist our government with fit testing, actually over 1,500 frontline workers, just because we had that training prior to the event. Next slide. We also had a number of training sessions on infectious substance shipping, and as well as train the trainers for infectious substance shipping. Now, the infectious substance shipping, I have to say, from this training, one of our achievements was that we would have one of our sister labs, which is the Forensic Science Center. They would require us to ship some of their samples. And you know that if it's a forensic lab, that these samples are very important, and you have to maintain chain of custodies and all of those other things, that because it's a police matter. So they would rely on us to do their shipping for them. So one of the achievements was that we were able to train persons at that institution, and know they are fully responsible for their shipping, right? And they would just come back to us if they need guidance or if they have any questions. And we thought that was quite an achievement. Next slide. So other training outcomes that we had, so since we had the number of training sessions over the years, and I would have liaised with a number of the labs to see how they were able to implement some of the things that they learned, and some of the protocols that they would have taken away from the training sessions. And many of the labs said that they were able to use the training to implement new ways of how they do stuff in the lab regarding laboratory safety. Some labs were able to establish functioning safety committees, and I must say, including my laboratory, that was one of our achievements. We were able to have provided small budgets to carry out virus management activities. And as I said before, we have certified dangerous goods shippers, and we even have requests from other labs to also train some of their staff to ship dangerous goods. And then we also have now formal linkages between the protective services to respond to certain biological threats and chemical threats if they have any. Next slide. So areas of improvement. So most of what we have done have been done on the informal level, and meaning that, yes, Barbados is a very small country, and we know everybody knows basically everybody. That's how we operate. So because of that, we have been able to achieve a lot of what we have done so far by just talking to each other and sharing information. But the areas that need to be improved, a lot of labs tend to focus on their quality management system, and they don't realize that, that laboratory safety is part of your quality management system, and that needs to come along with it. So that is one of the areas that we need to improve on. And then for my country, I will say that even though we have achieved so much as it relates to laboratory safety, sadly, the legislation that supports these activities is actually lagging behind. So that is one of the areas that we really need to pay focus and great emphasis on going forward. Next slide. So October is Biosafety Month, and I took this picture from the ABSA website, and we decided that one of the things we're going to have an activity to focus on biosafety, biosecurity this month, and right, to focus on biosafety, biosecurity this month. One of the things that we decided to do is that we're going to have a poster competition, and the topic would be WHMIS, which is the Workplace Hazardous Material Information System. And we are going to ask members of staff to use this and to see what they can come up with. We have also decided that in October, we are going to look at fire safety and first aid as well. Those are the activities that we have planned for the month of October. And this is just within my lab right now. And we are hoping, because this is the first time we are having it, and we're going to see how how successful it is. And as long as it works out well, our plan is to have it on the entire island around all the labs next year when the Biosafety, Biosecurity Month rolls around again next year. Next slide. Yes, so for next upcoming training, we have a request from our professional association to have a training session on biosafety and its importance in clinical laboratories, and that is due in November this year. And in the new year, this is a list of the other training sessions which we have planned in 2023. We want to look at BSL-3 operations, because that is actually important to my lab, seeing that my lab is the only lab that has BSL-3 operations currently. And then we also want to go ahead and look at virus management tools, the tools that are available to us that the labs can use to make what they do easier for them. And that is basically what we have planned for 2023, those activities. Next slide. So in conclusion, we have had many successes with very, very, very limited funding. And even though the funding was limited, we had decided that we would do what we could with that didn't require a lot of money, or in some cases, any money at all. It just required persons' time and energy to get it done. So we have been able to be successful in that area. We have been able to maintain our informal laboratory network among the labs. And because of the series of training that we have had for the last few years, we now have achieved a heightened safety awareness in our laboratories. And that is a very good achievement for us, I must say. So yes, that is where we are currently in Barbados. And I just want to take this opportunity right now to thank all of our laboratories for being very cooperative, and you know, because when we call and we speak to them, they don't have to, because as I said earlier, the legislation is lagging behind, and you know, there's nothing that mandates them to do it, but they do it because we basically have a network going and we know each other. So I have to thank the labs. I want to thank the labs for being so cooperative with us trying to achieve our biosafety and biosecurity discipline and make it better for the country of Barbados. Next slide. Next slide. Thank you very much. And I just want to apologize. I'm working from home, so my dog will say that he wants to behave badly. Thank you, guys.
Thank you, Gail. Now we will go over to our next presentation. So you can go to the next slide, Jacob. And Sam will be presenting, coming from a civil society, private sector lens on training and for biosafety and biosecurity. So over to you, Sam.
Great, thank you, Gabby. Hello, everyone. I just want to quickly thank the APP3 chairs and NTI for the opportunity to be part of this event today. Next slide. So for those who aren't familiar with Merrick already, we have a life science division that does quite a bit globally across design, commissioning, science, and technology. We work with different types of organizations, companies, government agencies, academic institutions across a variety of facilities, biocontainment facilities, research and development, animal, plant, human, food safety, academic science facilities as well. We're very much committed to ensuring laboratories are safe and secure worldwide. And much of our efforts are really focused on training. We do a number of webinars, trainings, workshops at the regional level, country level, and at an institutional level. We also launched our Science Safety Hub last year, which is a free online reference library for all things biosafety and biosecurity. But today I'm here to share with you a few of our case studies of trainings that we've done during the pandemic and have upcoming. Next slide, please. So this first case study was a training that we did in Algeria in partnership with an organization called Livestock International. This was, of course, one of those trainings that was supposed to be done in person at the very start of the pandemic, but because of COVID-19, we had to essentially pivot and think about how we could do this, if we could still do this remotely, and how that would work. So what we did was develop and facilitate what we call the remote engagement training program, and for 2 cohorts of veterinarians on community engagement to prevent transboundary animal diseases and implement biosecurity. So is this remote engagement program that participants received knowledge on identifying, reporting transboundary diseases that have zoonotic and economic consequences, biosafety, biosecurity, sample handling, and transportation. Additionally, participants were introduced to active learning training techniques that can be utilized during engagements with non-technical and low literacy stakeholders working with livestock. Following that completion of the training, what we did was wanting to continue this engagement, and we implemented a remote mentorship program, essentially supporting participants to continue what they've learned and to continue the development of their community engagement plans and own training manuals. Next slide. Another training that we did remotely due to the pandemic was a personal reliability program. So those that might not be familiar with PRPs, PRP is used to reduce the risk on an insider threat by providing a system for the early identification of factors that could make an employee potentially vulnerable to exploitation by an external entity, compromising employee results, resulting in an individual becoming an insider threat to a facility or institution. PRPs usually involve formal mechanisms for ongoing monitoring. This could include requirements for self-reporting, peer reporting, ongoing monitoring by supervisors, and penalties for non-compliance. Individuals in a PRP usually undergo periodic assessments, including annual physical examinations, random drug tests, reevaluation of medical records, medications, renewal of security clearances, and most importantly, personal reliability measures help reduce, but certainly cannot eliminate the risk of an insider threat. What we find is globally, there's really a poor recognition of the potential hostile use of life science knowledge or skills. And in many instances, this carries a greater potential threat that more than the agent itself. So with the Philippines, what we did was a remote interactive training. This was for over 40 lab personnel on personal reliability and insider threat scenarios. Before jumping straight into the training, what we did was assess first the legal frameworks that would enable or challenge PRP along with resources that are available in the country, as well as the capabilities of those institutions that we were targeting this training for. And then we developed the training tools and materials to that local context. And one of the outcomes from this training was that 5 of those institutions developed PRP plans, and 1 developed and presented the PRP implementation at their institution. Next slide. Another training that we have, which is actually forthcoming and based on the success that we've had conducting remote trainings during the pandemic, we're going to continue doing a remote training. And this is going to be an 8-week remote interactive training for at least 45 biosafety professionals and laboratory managers in the Southeast Asia region, focusing on integrated approaches to strengthening their biosecurity program as a complement to existing biorisk management programs. So participants from the Philippines, Indonesia, and Malaysia will be given hypothetical scenarios and work together to understand the differences between risk-based and threat-based programs as they contribute to wide system concepts of threat and vulnerability. We'll look at the 5 pillars of security, reliability, material control, transportation, and information security. We'll also consider a framework for building an integrated security program in ISP. So following this training, participants will be able to use templates that we provide for them for threat assessments and vulnerability analysis to essentially conduct site-specific assessments at their respective institutions. We'll also provide participants with remote office hours for mentorship and to review site-specific threat assessments, as well as feedback for participants to develop strategies for integrating biosecurity functionality into their biosafety programs. Next slide. The last case study I'll talk about today is a series of in-person trainings that we have forthcoming as well in the next few months, focusing outside of the laboratory. So these are actually going to be done in person now that travel restrictions have eased up. And this is essentially a training program for law enforcement, counterterrorism, counter weapons of mass destruction, and other relevant experts to review principles of CBRN, chemical, biological, radiological, and nuclear investigations, and strengthen partner governments' law enforcement investigative capabilities to prevent criminal and terrorist acquisition of WMD materials. So upon completion, participants will understand and be able to employ foundational aspects of CBRN investigations, establish mitigation strategies to prevent, detect, and disrupt criminal and terrorist acquisition of WMD materials. They'll also understand the influence, operational and national level implementation procedures and strategies for countering CBRN terrorism. This is going to be done 4 trainings in 3 different regions of the world: Sub-Saharan Africa, North Africa, as well as Southeast Asia. They're intended for mid-level personnel. We're going to consist of lectures, discussions, and some tabletop exercises. This is also being done in person, will allow for in-person networking opportunities for multiple countries and agencies. Next slide. So kind of thinking about training overall and sort of our perspective of, during the pandemic, obviously travel was not possible for much of the pandemic. And so, thinking about changing training, applying remote training opportunities, and kind of converting to online remote training, I think one of the biggest things that we learned is there are actually advantages to doing remote training. Cost certainly being one. There's some cost savings involved by using Zoom, as many of us are already familiar with. But really the challenge, I think, with remote training is just how do you keep that training engaging and interactive? It's hard to do, especially everyone joining a Zoom call being on video is not quite as interactive as you would like. So, for remote trainings, it works, but you definitely need to apply components, something like group whiteboarding sessions, facilitator scenarios, teach back presentations, engagement planning, writing, breakout sessions. So what we really found is with remote training does offer just different types of opportunities for participants to be active and engaged. We also felt people, felt more autonomized during some of the, polling pre and post assessments. There was kind of anonymous, completing one of those post assessments, it was anonymous. So people felt more comfortable providing their answers. And if they were wrong, that's okay. If they were right, that's okay too. And participants appeared to be more comfortable with that as well as providing feedback in a remote environment. There was kind of a level of safety, if you will. And remote mentorship, I think there's that opportunity to provide access to each other, especially in a country where, folks are joining from different parts of a country and otherwise would not be able to interact or engage with each other. And this was something we saw with the Algeria training. Last spring, there was cases of brucellosis in Tunisia, and there was kind of some conversations happening in our remote mentorship among the Algerian participants about the possibility of brucellosis cases coming into the country. So that gave them the opportunity to kind of share their insight and perspectives. Now with your remote training course, there's challenges, connectivity issues, slow networks, issues with participants' level of comfort with digital platforms, not having the opportunity to actually physically gather in a single area for the breakout sessions and have those group conversations. But overall, I think remote can still be valuable and effective. Certainly, it doesn't work for everything. And that's where, when the opportunity is appropriate, and in-person training is still the best, especially if it's actually going to be a hands-on type training that's needed to actually show, more of the operations and maintenance side of things, to actually provide in-person hands-on. This is not replacing remote, doesn't replace that, but I think moving forward, certainly remote can be valuable and effective and is worth considering for future opportunities. I'll pause there. Thank you all very much.
Thank you, Sam. Oh, go ahead, Jennifer. We're just about to do a quick intro saying last presentation for the panel, and for people to put any questions that you might have in the chat box. Thank you.
Thank you very much, Gabby. I really want to thank the previous presenters. They've all been really fascinating, and I would really love to learn more. Today, I'll give you just a very brief overview of the activities that we're doing at the World Organization for Animal Health, and shining a light on another kind of capacity building program that is not strictly training, but that has been really successful in helping to address and raise awareness about some of the challenges that were very well highlighted in Gail's presentation on the training program in Barbados. Next slide. And so the World Organization for Animal Health was founded as OIE. You might be familiar with that acronym, but we now have a new acronym called WOA. And we are working to improve animal health and welfare across the globe. Next. And we are building biosafety and biosecurity capacities within the veterinary services part of the public health system in our member countries, and focusing on the international standards and guidance that we develop, specifically related to biosafety and biosecurity, focusing on leadership building programs and mentorship programs as well. And then also focusing on the performance of veterinary services, or PDS pathway, where we are really working to conduct in-depth evaluations and assessments with members so that they can address the gaps and weaknesses and strengths that they have in their veterinary services system. We're also using data-driven policy and data to inform our advocacy approach, and thinking on how we can innovate and think differently about the future. I will just focus today. You will have all the slides available for you in the future, and that each of the slides has links to the different web pages where the program is described or where the documents are accessible. And so I wanted to, I will only go over a few of the points here today with you, but I would be happy to talk with any of you or answer any questions at another time. Next. First, the international standards. We have chapter 1.1.4 of the terrestrial manual called Biosafety and Biosecurity, the standard for managing biological risk in the veterinary laboratory and animal facilities. This was adopted in May 2015, and we've moved away from the biological risk grouping approach and are embracing a biological risk management approach, which is more practical and more sustainable. And in keeping in the idea of saying sustainability in mind, we really wanted to focus on leadership and mentorship opportunities for our veterinary services community in order to make sure that biological risk management advisors or biological risk managers, however you may call them in your laboratory setting, have the skills and competencies that they need to lead the development and implementation of biological risk management systems within your laboratory system, that they're responsible for developing and maintaining the documentation in all aspects of that system and monitoring the system within the laboratory network. Next slide. We've also made lots of documents and workshops related to the topic of biological threat reduction, suspicious biological events, responsible conduct in veterinary research as well, and then bridging epidemiology and forensics. You can access them here on the link listed next page. In order to address the leadership competency building that we wanted to target, we have worked with FAO, WHO, ECDC, US CDC, and APHL to develop the Global Laboratory Leadership Program, or the GLLP. And the purpose of this competency framework is to outline the essential competencies needed by laboratory leaders to build and direct sustainable national laboratory systems for disease detection, control, and prevention in health systems. And we have worked very hard over the past few years to develop a multi-sectoral and One Health approach, very ingrained in every aspect of the program, from planning and implementation to content to monitoring and evaluation. It's meant to address the entire national health system, health laboratory system, and the document is available in many languages. Next. The 9 competencies that are outlined in the document are listed here. And so I just wanted to note that there is competency related to biosafety and biosecurity. Next. This is an animated slide, please excuse me. But there are many, the competencies that you need in order to be able to lead and manage a good risk management system are present all over. Next. Next. You can see they're going to be in research, emergency preparedness. Next. Laboratory system, disease surveillance and outbreak investigation, communication, leadership, and management. All of these areas are going to have fundamental competencies that will be needed to have a successful biosafety and biosecurity risk program. And so the work that we're doing is helping to build these competencies through national level or subnational or sub-regional workshops and learning programs that are ranging anywhere from a few months to 2 years period of time. And so if any of the members that are present today are interested in learning more about this program, it's not for individuals, it's for country cohorts. So we'd be very interested to learn how we can help you to build a program in your country. Next. Next. Just to give you an idea of what the competency framework looks like on the inside of the document. Next. We also have the laboratory twinning program at WOA, where we're pairing WOA reference centers on different diseases and different health topics with candidate laboratories that are interested in taking them that last mile to achieve reference laboratory status or to gain critical and regionally important expertise in their laboratory network. Next. If we think about the GLLP that I was mentioning earlier, and next, the competency framework that I've mentioned, we've also, this is also another animated slide. You could go ahead and bring the others, I think 3 more times. Next. We have now, for the animal health laboratory setting, all the technical veterinary laboratory staff now has the competencies and curricula guidelines defined for them. Next. Next. So from the laboratory leaders, laboratory directors, managers, and department heads to laboratory veterinary paraprofessionals like technicians and assistants, all technical veterinary laboratory staff now have competencies and curricula that are developed for them and ready to go. And we offer many capacity building programs related to that. So again, based on country request and country interest in developing these areas more. So please be in contact with me. I'll put my email in the chat so that we can discuss more if you're interested. Next. We also have a training portal where we make information available through e-learning modules. Next. And we have different critical competency packages that are listed here. And even though we do have a specific competency package on laboratory services, number 4, laboratory competencies, again, are going to be present across many of the competency packages. And so we're currently developing the breadth and the depth of this program to make learning materials more available to individuals so that they can pursue their continuing education and professional development goals. Next. If we think about the PDS pathway, the performance of veterinary services, next. There is the targeted support section, number 4, next. And we have the Sustainable Laboratories mission, where we're going to, upon country request, we will look at the laboratory infrastructure and help them to determine the resources that they need. So instead of being an exercise related to benchtop activities, we're really thinking about the management and sustainability of the laboratory network on the veterinary side. We encourage the participation of all laboratories that are working in the veterinary domain, and also could be interesting, especially given the things that have been mentioned here today, to pilot using a One Health approach and see how robust the tool can be to help determine the resources needed to meet the demand and the need for all laboratory services in the One Health area. Next. Next. So from those missions, we've conducted roughly 25 missions to date. Taking all the information that we have provided, we now have available on our webpage dynamic dashboards, so you can explore some of the issues and insight that we have uncovered by looking at this data in a cohort fashion. We have information related to diagnostic capacity, clients and revenue streams, legislation, and the cost of analysis, the real cost of analysis versus budget allocation. So I would encourage you to take a look. Next. We also will have more coming on this page. Well, we will include information about what this cohort's resources look like in terms of biosafety, biosecurity, quality management systems, laboratory equipment management, human resources, etc. So that will be the next chapter to come on the dynamic dashboards. Next. We've also looked at laboratory equipment management. We have dynamic dashboards available there that you can also take a look at. Next. And we've also on our YouTube channel have developed a 2-minute video related to biosecurity in the veterinary laboratory setting and the importance of sustainability to ensure, given that biosafety and biosecurity can often be very resource intensive, both in physical resources, human resources, and financial resources. We're really focusing on that aspect of sustainability here to ensure biosafety, fit for purpose biosafety and biosecurity measures, especially for low and middle income countries. Next. We also are looking at the areas of research that can be expanded to better understand and develop fit for purpose measures for biosafety and biosecurity, working on a biosafety research roadmap. Next. And also on the grand challenge approach to find truly transformative solutions which can address the whole system. And so these are really interesting opportunities for the future. Next. Here again, you have all of the links and the resources here. And I thank you very much for your attention.
Thank you so much, Jennifer, and to all of our speakers. It was very nice to hear from multiple stakeholders, from national governments to private sector and to international organizations, just hearing about the types of trainings that they're providing to fill the gaps of those biosafety and biosecurity capacities. So I would like to acknowledge that we are running behind schedule. So if you need to drop off, we are recording this session and we'll be sending out to everyone who registered for the event. But please also feel free to stay as we proceed with the rest of our program. So now we're going to turn to the Q&A session. So people can either drop their question into the chat or you can raise your hand, unmute yourself and ask the question. So I will see if we have any raised hands really quick. Okay, let me check the chat really quick. Okay. So I am currently not seeing any, so we will just go ahead and move on to the next portion of our agenda. And if anyone does have any questions, please feel to drop them into the chat. And all of the presenters have also put their information into the chat, so you can reach out to them individually if so desired. So I would like to turn to our last part of our program, looking at the future of biosafety, biosecurity. We heard from Dr. Mukumbi on the history of APP3. We've heard from current APP members on what they're currently doing to fill those gaps in biosafety and biosecurity. And now I'd like to turn to our last presenter, Haley Severance, to talk about the future of biosafety and biosecurity. Haley is the Deputy Vice President for NTI's Global Biological Policies and Programs team. And in her role, she supports and leads the team's efforts to reduce biological risks that imperil humanity. So over to you, Haley.
Thank you so much, Gabby, and thanks to the previous speakers. This discussion really showed kind of the breadth and the depth of all the global activities ongoing to ensure that, you know, the world builds stronger biosafety and biosecurity capacities, and specifically how we're all cooperating and engaging through this important platform that the APP3 provides. So Gabby already introduced me, Haley Severance, Deputy Vice President of the NTI Bio team. But I just wanted to provide a few comments for how we move the APP3 and global health security agenda into the future. Global health security agenda has always been a really catalytic body pushing for kind of radical changes for how we think about health and security. It's given us a roadmap for how we define the different aspects of health security and gave us common goals to work toward as more of a united community between the different sectors. And it also has urged transparency and coordination through broad-ranging assessments that have eventually become the joint external evaluations that the World Health Organization has adopted. I would urge us to apply this creative and collective problem solving to the issue of biosafety and biosecurity, since it really is at a pivotal point. The pace of scientific advancement has been increasing, and it's been really remarkable over the last decade, and really only accelerating. This has really been important in protecting our health, the environment, and economic development. But if these scientific advancements are not safeguarded against unintended risks, we really do risk losing the ground we've made as a community, and in a worst case scenario could trigger a man-made pandemic, which is what we're all here to try to prevent. The APP3 group has come together in the past to address emerging risks such as those posed by COVID-19, SARS-CoV-2. But I would urge us to be even bolder as we consider what's next. Specifically, we must be thinking about how we build the safety and security systems we need 5 to 10 years down the line. The programs that were described before are great benchmarks and examples of how we're building kind of those capacities that can be flexible in addressing emerging biological risks. But we must also be thinking about how to actually incentivize safety and security as a part of and not contrary to or counter to economic development. And we really do need to incorporate the voices of the next generation of biosecurity professionals, both not only for their innovative ideas, but also to instill that culture of biosecurity and responsible conduct that can be carried beyond our time. And then finally, we need dedicated financing and political attention for biosecurity. For example, it would be critical that new financial intermediary fund works across all of the GHSA technical areas, including biosecurity, to ensure gaps are filled. So as GHSA leadership comes together next week in a steering group meeting, and as we all prepare for the upcoming ministerial in South Korea, it's critical that we raise our voices to make sure biosecurity remains a clear part of any future agenda. And so I don't want to take any announcements away from our great APP3 chairs, but I do want to emphasize that APP3 hopes to host a side event during the ministerial, where we can hopefully, come together and be able to map out what the future of cooperation in biosafety and biosecurity looks like for the global health security agenda. So I'll keep it brief, and back to you, Gabby.
Thank you so much, Haley, and thank you to all our presenters who have presented either what their current program's doing or how we're working to progress to the 2024 GHSA goals. And just want to reiterate that today's recording will be sent out to all participants who register for the event, and I will pass it over to Anand, who will give closing remarks.
Thanks, Gabby. I won't keep everyone for too long, but we'd like to thank you for joining today, for your active participation, and many thanks to our honored speakers and to the action package for doing such an excellent job in lining up excellent and informative speakers. Thank you all, and I hope you have a good day and a good evening. Thank you.
Thank you, everyone.